Bismillah Rahman Rahim. Assalamu alaikum. Breathing, it's something we all take for granted, right? But for millions of people, every breath can be a struggle. In today's vlog, we are tackling bronchial asthma. What it is, how it affects your life, and what you can do to breathe easy again. Whether you are living with asthma or just want to know how to help someone who is, stick around, you are in the right place. Ever felt like you were breathing through a straw? That's what an asthma attack feels like. Let's talk about it and how we can prevent it. Asthma is more common than you think. But the good news is it's manageable. Let's break the myths and talk about what really works. Do you know that over 300 million people worldwide struggle to breathe because of bronchial asthma? Could you or someone you love to be at risk? Let's explore how you can manage asthma and reclaim your life. In this vlog, we shall talk about what bronchial asthma is, its triggers, symptoms, and most importantly, how to take control of it for a healthier life. Meet Sarah, a 28 years old school teacher who loves spending time outdoors with her family. But for years, Sarah has been battling something that most people don't see, a chronic condition that makes her feel like she is drowning in air, bronchial asthma. Sarah first noticed something was wrong when she began experiencing frequent episodes of coughing and wheezing, especially at night. She often felt tightness in her chest and struggled to catch her breath, particularly when she was around dust or during cold weather. Her symptoms seemed to get worse in certain situations, like when she was cleaning, walking through the park during pollen season, or catching a cold. It wasn't until one day when she had a severe episode during a class and she realized she needed help. When Sarah visited her doctor, she was asked about her symptoms, family history, and lifestyle. After a few simple lung function tests, the diagnosis was clear. Sarah had bronchial asthma, a condition where the airways become inflamed and sensitive to certain triggers. The good news, asthma is manageable. Sarah's doctor explained the importance of avoiding her triggers, prescribed an inhaler for quick relief, and a controller medication to keep inflammation at bay. With proper treatment and regular follow-ups, Sarah began to feel like herself again. Today, Sarah lives an active life, proving that asthma does not have to hold you back. Her story is a reminder to pay attention to persistent symptoms like coughing, wheezing, or breathlessness and seek medical help early. Remember, with the right care, you can take control of asthma instead of letting it control you. Key takeaways from this case history. Symptoms to watch for, these include coughing, wheezing, chest tightness, and breathlessness. The common triggers for asthma are dust, pollen, smoke, cold air, exercise, and respiratory infections. Importance of diagnosis is that early detection can prevent severe attacks. And the management tips are: avoid triggers, use medications as prescribed by your doctor, and monitor symptoms regularly. Do you know someone like Sarah who might be struggling with asthma? Share this video to help spread awareness. And if you have any question about asthma, drop them in the comments. I'll answer them in my next vlog. Remember, asthma is manageable and awareness is the first step. To recap, bronchial asthma is manageable with early diagnosis, avoiding triggers, and following the right treatment plan. Remember, every breath matters. Asthma doesn't have to control your life. Let's discuss a few important medical aspects of asthma in the learning sequence. Bronchial asthma is a chronic inflammatory respiratory disease characterized by recurring episodes of reversible airflow obstruction. There are at least 5 types of asthma, and these are allergic asthma, which is triggered by allergens like dust, mites, and pollen. Then number 2, the non-allergic asthma, which is triggered by irritants like smoke and pollution. Third is exercise-induced asthma, which is triggered by physical activity. Fourth is occupational asthma caused by workplace exposures. And the fifth is nocturnal asthma, the symptoms they worsen at night. What are the causes and risk factors? Research shows that different causes include genetics predisposition, allergies, respiratory infections, air pollution, tobacco smoke exposure, obesity, premature birth. Those who had premature birth, they are prone to develop asthma in their later life, and family history of asthma. The symptoms which we learned, these are wheezing, coughing, shortness of breath, chest tightness, and wheezing or coughing at night. And the triggers we should be aware of, these are the allergens like dust mites, pollen, pet dander, respiratory infections, air pollution, tobacco smoke, exercise, stress, weather changes, and medications like beta blockers or aspirin. For the diagnosis, doctor will take your medical history, will do the physical examination, may do the spirometry, that is the lung function tests. You blow in a machine and your blowing efforts and your amount of air you blow out, it's measured, peak flow meter, and at times methacholine challenge test is given and allergen testing, but all these are done in the medical setting. The treatment includes drugs, medications, and we give them mostly in the inhaler forms. So the bronchodilators, steroids, inhalers are oral, leukotriene modifiers, mast cell stabilizers, and immunotherapy for allergy shots. We need to have the lifestyle changes by avoiding the triggers of asthma, having regular exercise to the tolerance level, healthy diet, stress reduction, quit smoking if someone is smoking, and monitor symptoms and lung function tests. For the asthma management, doctor will create an asthma action plan for you. You have to monitor symptoms and lung functions and adjust your medications as needed, and of course, keep the regular follow-ups with healthcare provider. So dear viewers, do you have any questions about asthma or tips that work for you? Please drop them in the comments below. Let's learn together about the asthma. So I end here. See you in the next video on another health topic. Till then, take care. Khuda Hafiz.